Всем привет, дорогие друзья, с вами Нейм. Я начинаю проводить такую рубрику, как обзоры симулятора. Сейчас у нас на обзоре симулятор вросшего ногтя. Вот, то есть это так будет выглядеть как-то. Ну и сейчас мы будем удалять ноготь. Так, загрузочка.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I will be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe.
Вот, он нам типа сказал то, что если вы ударились или там... Да, вот вы ударились, да, и вы заплевали на эту рану. То, что вам сразу же ее надо идти обрабатывать. Ну, короче, ладно, вот начинаем играть. Нам предлагают обработать как раз таки эту рану. Вот мы ее обрабатываем. Все.
Now we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Угу. Так, теперь нам надо ставить укол, типа, да? Отлично. Да. Все, уколы мы...
Great. Now we'll wait a few minutes for the toe to get numb.
Ему 5 минут ждать? Чё? Если мы это не будем на самом деле 5 минут ждать. Ну да.
Now that our patient's toe is numb, place the special tourniquet around the toe.
Так, теперь...
This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toe.
Вот, это такая штучка.
First, carefully slide one blade of the nail anvil under the affected nail.
Мы перекрыли исток крови. Чё? Нам чё? Резать ног? Ну ладно.
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
Такой звук еще.
Great. Take the forceps and carefully remove the ingrown nail.
Теперь нам надо удалить вот этот ноготь. О!
It's getting kind of messy in there. Let's clean up that blood.
Так, теперь...
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection.
Он руками это убирает? О, серьезно? Невозможно.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Мы убираем остатки грязи, да? Так.
Finish by applying some antibiotic ointment on a sterile gauze.
Так, это антибиотик.
Place it against the toe and wrap it in a gauze bandage.
Все.
Fantastic job.
Отлично, операция.
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Все. Если вам понравилось видео, подпишитесь, поставьте лайк. Ссылку на игру я оставлю в описании. Всем удачи, всем пока.